Good. Thank you very much for your time. I didn't live at a developmental center. I lived in a house with 3 other disabled people. But basically, I don't know where I would be without those kind of homes because it helped me a lot. And what I want to bring to the table today is when the people move out of the developmental center, we need to make sure that they have the right care that they have. Because when I moved out on my own, like 12 years ago or 15 years, I don't quite remember, but I didn't have the right care I have now. And we need to have backups for people with disabilities too. So like if their caregiver calls out, we need to have more people that are trained to come in and help them. Because I'll use myself as an example. Well, this never has happened, but I could be stuck in bed till the next person comes, or stay in my wheelchair till the next person comes to transfer me to get into bed because I can't transfer myself and I have a hard time cooking. And so I just feel like we need to have like a pool of people that could come and help people with developmental disabilities and whatever that may be. And I'm sorry I'm using myself as an example, but I don't have no other person to use as an example. So that's basically all I have to say. I know it wasn't 5 minutes, but
no.
You know. So
Ray made up for you by about 4, so it's all good. Wes, one of the great pieces is we don't want you talking about anybody but yourself.
Right.
Because there is no one better to talk about what the experience has been by the individual who's lived through it. So we're really grateful.
And I want to thank you guys, like I said, for your time.
Yeah, absolutely. Can you hang for just a second?
Yeah, no
We're gonna
problem.
open it up for questions. So we'd like to be able to see from the senators if there are any questions or comments before open it up. I have a quick question, if it works for Ms. Ritchie. So obviously we're approaching the eve of the MCO tax here, again, knock on wood, on Thursday, right?
Yes.
Want to get to the issue of as we transition. We had a conversation about this a few weeks back. I think the number that the organization has put out is about 435 vendors have left the system.
Oh, you're talking about closures?
Yep.
Actually, I have updated information.
Great, please.
That I put together just
do you mind going through that?
fast.
That would be great.
Okay. Actually, we updated the data that we had put out in our first report. So the data that I'm going to go through is from July 1, 2011 to June 30th, 2015. And during that time period, 521 residential homes have closed that could have served potentially 2,700 people. 64 day and work programs have closed that could have served 1,450 individuals. And for supported employment, 15 programs have closed that would have served 176 people. And for supported living, 29 programs have closed, of which that would be 205 individuals that were impacted.
Do you mind following up with an email with those updated numbers?
Of course.
So the other question I have is, there's been a lot of discussion about staff. And what we've heard from department representatives, it's hard to be able to attract staff for developmental centers, even with the salary schedule that the state has. But I don't want to speak for you, but I believe it's even more challenging on the regional center side for those vendors that you're working with because of the schedule that you have. Can you talk about that?
Yes. Actually, and Tony is here, the chair of the Linderman Coalition, when we first started talking about negotiations and our position as a coalition, one of the questions that we asked all of the service provider organizations to do is to go back and talk with their members about will this make a difference? And because we would certainly hate to have worked on trying to get an increase for our system for over 2 years and still have the type of crisis situation that we currently have. And what we heard from service providers within the Linderman Coalition was that the salaries and benefits would definitely help especially in the area of compaction and also with senior employees who had been with service providers for a long time to make sure that you retain that staff that may be working alongside staff that had just come on the job that were making exactly the same amount. And then the other piece in the MCO deal that service providers thought was a very important piece was the 2.5% for administrative costs. And so there are a lot of service providers that have had to dip into their reserves that may have vehicles that need to be replaced, have extensive gas and other bills that are not covered. And so that's why we all discussed and felt that the administrative piece was also a very important piece specifically for service providers. There also is, we also have very high turnover within the regional center system, certainly not as high as within service provider organizations, but as high as 30% turnover among service coordinators. So we're very pleased with the proposal that the administration has put forward.
Last question for you is how are these additional, you said 521 residential homes, which have impacted, we've gone from 2,300 to 2,700 beds. Mm-hmm. How does that impact, or will that impact transition of residents from developmental centers into the regional center system?
Well, for the majority of individuals that are transitioning from the developmental centers into the community service system, in many ways, we've almost developed a two-tiered system in that as you know, I worked on the Ag News closure, what we really try to do when we're approaching a closure is very much look at the individual needs of each person, and then work on putting the pieces together that to meet that person's needs. So that may mean that regional centers have to go to the department and get health and safety waivers to pay above the median rate.
Has it, I guess maybe the question is that how many homes have opened versus closed in that same period of time?
Now, we did not even ask that question.
Because I think that's important, as what we're hearing from department is that there's the funds there to be able to open, but what we've seen is a significant expansion of closures, I would assume because of reimbursement rates is one of the big drivers.
It's a couple of things. First of all, people who are in developmental centers or at risk of going into the developmental center have the option or the opportunity for startup. That is really a critical piece to be able to fund startup for developing a new resource. And so that makes a significant difference. The other piece that I think is really important for us all to keep in mind, and we've had so many questions about what's the net effect, but the reality is that our service system is really designed to meet the individual's needs. So just because a home closes here does not mean that that home meets that person's need, that it's the level of care for that person. All of the CPP funds and the startup is focused on people leaving the developmental center or at risk of going into the developmental center. So that's how we've set up kind of a two-tiered system. And in order to really track, you would have to go back and look at each individual's need, the home that closed, and was there anything that opened that met that person's need? And since the great majority of all the homes that are opening because of CPP dollars, which are just for people leaving the DCs, you can see the pent-up demand, especially among families who have children with autism, to develop new services to meet those unmet needs that are going unmet.
And I just added that to our parking lot, so I really appreciate that. And if we can follow up, that would be fantastic.
Absolutely.
Again, thank you so much. Senators, any other questions or comments, please, Senator?
Ms. Ritchie, the data you just shared in terms of the 521 home closures, when Senator McGuire asked that question at the top of the hearing in terms of the number of closures and cited the 400 and some odd number, Deputy Director Doyle responded by saying that they all have been, closures. They may have transitioned into another level of care. Does your data get drill deeper to really understand it? Was it a complete closure? Was it a transition? Because I'm trying to get a sense of
I understand.
reality.
Right. And no, our data would not tell. In fact, we do have anecdotal information that there are certainly times when individuals, because their home closes or their services are no longer available, may go into a higher level of care. They're not going to go into a lesser level of care, but a higher level of care because that's all that's available.
That's following the resident, but my question is, in terms of getting a sense of if it's a net loss of 521 or not, we don't know if those closures are the facilities themselves transitions into another level of care. You follow me? That was my understanding from Deputy Director Doyle in terms of his response.
Yeah, I think that perhaps that may have happened in some instances, but I would find that to be kind of unique.
Got it. Okay, but based on your data collection, we can't track it based on the way you collect your data. Thank you.
I want to say thank you so much to our panel. We're really grateful, and thank you for taking the time and for your patience today and for hanging with us as well. We're going to be bringing up panel number 2 on our final panel. This will be our final round. We have Rebecca Donabed, member of the Self-Advocates Advisory Committee of the State Council on Developmental Disabilities, Catherine Blakemore, the Executive Director of Disability Rights California. I'm going to be hitting up some coffee here in a second. Hot dang. Marty Emoto, he is the California Person-Centered Advocacy Partnership. We also have Tony Anderson. He's the Executive Director of the ARC California, and straight from the County of Sonoma, Mr. Rod Stroud. He's the Special Projects Director who's going to be talking about his experience on the SDC. So we're going to be starting with Rebecca. Ms. Donabed, she's going to be discussing the need to ensure services are in place. Yep, she's heading up right now. Welcome. It's good to see you. And she's going to be talking about the ability to ensure services are in place before residents are moved out of developmental centers. And I will be grabbing that cup of coffee here shortly. And welcome, and thank you so much for your patience today. We're happy that you're here. Thank you. Thank you. And I'm going to ask, there we go, if we could just move that a little closer. Thank you so much.
Okay. Thank you for the opportunity for me to speak today. My name is Rebecca Donabed. I am a council member for the State Council on Developmental Disability, and Porterville is in the region I represent. The most important support required during and after the closure is trust. When an individual works in the developmental center, that person has to develop a trust relationship with the staff. When they get out, they need to develop a trusting relationship with a new service provider. They need to trust the provider will follow through an agreement in IPP. This makes a person feel safe and secure in the new environment. Providers need to work to establish this trust. The most important service required during after the closure of local medical providers who are experienced working with people with intellectual and developmental disability building includes dental, nursing, and mental health provider. This service you must use behavior specialists who have crisis intervention training. Also, transportation and recreation things people want to do are important for full life. But system doesn't work now for people who fail in the community. When a person has a behavioral crisis that a service provider can't resolve, the often committed under 5150 and held up to 72 hours for assessment and intervention. This is the one use of fast system. Regional centralized established crisis team that provide behavioral intervention and temporary housing needs the client. There are 10 accused crisis residents identified at Fairfield, D.C. About 1,000 people leave the center and going to the community. These beds will not be enough. We need more local crisis intervention services. Thank you.
Becca, you did a great job, and we're so happy you're here. Can you just hang with us for a little bit? Is that okay?
Yep.
Great job, and thank you so much for providing your personal testimony as well. We're glad you're here. Thank you. We'd now like to be able to move to Catherine Blakemore, the Executive Director of Disability. Again, I did not take the coffee yet. So Disability Rights California. I heard it was Margarita Monday yesterday, so watch out. Did you hear that, Senator? No, it was National Margarita Day.
I had no idea.
Senator Lou had her annual party, so watch out. Hey, see, there we go.
She did step out.
Hey, that's right, exactly. Hey, nothing better than Carlo and Rossi. Head over to Senator Lou's. Hey, there we go. She's going to tell us about the need. Poor Miss Blakemore's thinking, oh my gosh, what's happened? Hey, there we go. She's going to tell us about the need for an enriched community system and having services that are tailored to people's needs. Ms. Blakemore,
Thank you. So I think I'm going to start by saying thank you to all of you for hanging in there with all of us. And I think this hearing has been really informative, and we appreciate the time and attention you've taken to everyone who's had information to share with you. And I also want to thank all of you for your involvement in the MCO tax, and particularly the focus on shoring up the community system. That is really an important first step for so many of the issues that we're talking about. In the interest of time, I'm really just going to go through a series of recommendations, and I have written testimony that I'm happy to provide to you. And I want to talk about recommendations in 4 areas, the first of which is creating a strong community safety net. We've talked some today about the need to develop new kinds of placements. One of those are enhanced behavioral support homes. The department has submitted now regulations that are a critical piece to those homes opening. We, at least as of 2 days ago, did not have the companion regulations from the Department of Social Services that will provide further clarity on some of the techniques and things that can be used in those homes. So if you want to do something helpful, you could inquire of the Department of Social Services when those regulations would be forthcoming. We also need to, as we've talked about, develop increased community crisis capacity. One of our worries is that we will not have adequate capacity in place and that people will then continue to be referred to what we call in California IMDs, Institutes for Mental Disease, which are locked, really skilled kind of nursing facilities. Those are not places we should hold out as someplace our folks should be living long-term. We also want to encourage that the state takes seriously its responsibility to develop what we in the DC Task Force report call placements of last resort, and to wrestle seriously with the question of what is the state's role. We can see two ways that that could happen. The first being that the state play an active role in ensuring the quality of services that are provided in those places by private providers. One of the things the state has done well is when someone is trying to move out of the short-term acute crisis unit is have staff who can address the glitches that inevitably happen with licensing or with other places, that there's dedicated staff that can intervene. We also think it's appropriate to consider whether the state should continue to run very small, limited numbers of places when no other facility is available for someone to go to. But those are important questions that need to be addressed as this discussion continues. We also want to make sure that there's adequate oversight of facilities providing the crisis-type services and the more enhanced, the enhanced behavioral homes. One of the ways that we want to do that is ensure that DRC gets access to data about what's happening in those homes. One of our most important responsibilities is investigating abuse and neglect that occurs both in developmental centers and the communities. We have in our testimony some proposals about how those statutes that currently give us data about DCs could be expanded to the community. We also think for individuals that are in crisis homes, for example, that and IMDs currently, that regional centers should have funding to have the same service coordinator caseloads, which are reduced, which allow for more intense case management so that individuals can more quickly move out to a place that is not in a crisis mode, but a place that can more appropriately serve them long-term. Second, we want to talk about service complexities. We've talked about what needs to happen in the community. The community system is driven in part by the need to use generic resources, and that does not always go smoothly. In 2009, we imposed all kinds of limitations and requirements around using generic resources. One of those that is particularly important in supported living is the use of IHSS, because that is a requirement that you now use that. IHSS does not always provide the level of care that individuals need. We think that the IPP team should determine when IHSS is an appropriate generic service and when it is not. And when it is not, then that should be a service that's funded by the regional center with adequate funds so the regional center system can do that. So we've proposed, and I'll give to you statutory changes that we think would encourage that. We also know that accessing, pardon me?
You have about a minute and a half.
Okay, I'll talk, I can talk really fast. We also think that the requirement for accessing medical services should be changed because right now families have to go file an appeal with Medi-Cal before the regional center can access and provide the service. That makes no sense. Families are very stretched. Saying you now have to go to an appeal doesn't particularly work, and it's not really designed to save the state any money, except that people don't file their appeals, right? It's all state dollars, so eliminate the requirement in that people have to go through an appeal. Again, we have language for you about that particular requirement. We've talked a lot about dental care. There's two things that we think need to be addressed with dental care. The first of which is we have to deal with the rates issue so that people can access meaningful dental care in the community, and that would include adequate rates to increase increase the availability of anesthesia dental care, which is a way in which many people need to do it right now. Everyone has said that is not a service that's available. I've also given some recommendations about mental health care. The last thing I want to just say briefly is for families in the developmental centers, there is an interest in using the self-determination program, which is the new model of service that provides people with an individual budget. Unfortunately, we have yet to get the federal waiver approved, and that in part is tied to the state's transition plan for transitioning all home and community-based services. So something to pay attention to that many of us are working with DDS on, who's very collaborative in this process, is finding a way to get that waiver done. So that'll provide a meaningful opportunity before all the developmental centers are closed. So with that, I will get you my testimony, and thank you very much for the time.
Blakemore, that was wonderful. Thank you very much, and do look forward to seeing that in writing.
Absolutely. I have it with me. I'll leave it for you.
Wonderful. And again, thank you so much for your time and your advocacy as well.
Thank you.
It's good to see you. All right, we'd like to be able to transition over to Mr. Ramoto. He's with the California Person Centered Advocacy Partnership. He's going to be talking about the needs to be able to strengthen the community system. Mr. Ramoto, it's great to see you. You have 5 minutes, sir.